This is the Pharmaverse Podcast. I'm your host, Michael Pietrack, engaging leaders from the pharma universe. Welcome back to the Pharmaverse Podcast. I'm your host, Michael Pietrack. If you're a leader or an aspiring leader in the pharmaceutical industry, you've come to the right place, because we interview the brightest stars from all the different corners of the pharma universe, and today's guest would certainly fit that description. I'm joined by Shon Remich, MD, who's the Chief Medical Officer at ARMR Sciences, and we're going to be diving into his military background, his transition into industry, and advice for leaders and aspiring leaders. So, Shon Remich, welcome to the Pharmaverse.
Oh, it's great to be here. Thank you, Michael.
Well, I got to say, Shon, you have such a unique background. I'm excited for everyone to learn about it and dive in. But before we do that, tell us a little bit about what you're developing at ARMR Sciences.
ARMR Sciences, well, we have a mission, and that is to save lives. And we're taking on the opioid epidemic, so not a small task. I'm not sure if you're aware, but we lose about 300 lives a day to overdose and to poisonings. Since 2016, overwhelming number of deaths have been from fentanyl. Fentanyl is the number one killer of adults aged 18 to 45 in the United States. And again, that's not a well-known fact. So our lead candidate is a prophylactic immunotherapeutic to protect individuals from fentanyl poisoning or overdose.
It's fascinating. I did not know about those statistics. They're staggering. Where do you see this technology being utilized? How would it work?
Well, I mean, it's been an exciting and challenging journey so far. We've learned a lot, and in the process, we've developed a platform which we hope will allow us to quickly address other chemical entities that are causing overdose deaths and poisonings. In particular, those threats that either don't respond or are resistant to naloxone, chemicals like xylazines or nitazines, which are growing in the U.S.
How could someone check out what ARMR's doing? What's the website?
It's ARMR Sciences.
ARMR.com?
Correct.
Got it. Yeah, so ARMR is spelled ARMR, not like we would traditionally spell it. Such a cool, I know you guys went through a name change recently. I'll also post the website in the information below, but it sounds like a product that's really for the greater good. And that's really been your MO for your whole career, it seems like. You spent over 20 years of it in the military and in the Department of Defense. What was your main focus over those years?
Well, I started out in pediatrics, and I guess I'm still a pediatrician at heart. Kids are great. Parents are more of a challenge. I know that because I'm a parent, but I felt like I could do more, and I was drawn to product development. So I left pediatrics and the military actually at that point, started a postdoctorate at Georgetown in clinical pharmacology, and that's a fellowship that really focuses on product development, particularly small molecule. And then went back into the military, and at that time, I can honestly say my passion was global health. There was a great marriage between impacting global health and the Army's product development program. So I could combine my love for taking care of soldiers and their families, and at the same time have an impact on global health. So it was a great fit. I did 2 tours in Kenya, the first focusing on malaria, and then the second focusing on HIV.
That's amazing. And it really does go right into your mission with ARMR Sciences. Another question about ARMR Sciences before we really dive into more of your background. Like, what's the application? Like, is it if someone already has overdosed? Is it trying to prevent overdose? How does it actually work? What can you tell us?
Yeah, one of the struggles that we have had is that we need an effective treatment, and we have that. Naloxone is extremely effective, but oftentimes it has to be used multiple times, and the window to administer that is about 2 to 5 minutes, and you're depending on the lay individuals to do that. So it's a bit of a challenge. There was a study done by the University of Ohio that they did a questionnaire and found that about 30% of the individuals that they talked to felt comfortable that they could administer naloxone effectively. So interval to administer the medication is small. The lay people that are able to do that and have access to it is relatively small. So we felt like really a prophylactic agent is what is really needed, something that can be taken before an exposure and then protect you during an exposure.
So I'm trying to, again, just think through. So when would a person actually take it?
Yeah, so right now our primary indication would be first responders and DoD, military individuals who may be exposed to it. It's been used in historically, carfentanil in particular, as a weapon of destruction and chemical warfare. But individuals that are first responders going into situations where they're going to be exposed to things that they're unaware, one of those could certainly be fentanyl. So we want to protect those particular individuals, and we think that there's a high correlation to protecting America and the U.S. and our borders.
Oh, that all makes sense. Okay, I can picture it now for the first responders and military personnel. That makes a lot of sense. All right, now back to your career. Okay, you spend all this time in the military and Department of Defense. Now you're breaking into industry. It's 2016. You're breaking in with Pfizer. It was in their clinical development team, right? Developing vaccines?
Yes.
And it had to be an amazing experience because it was right during the COVID-19 vaccine development.
It was. It was an incredible experience. My wife jokes that I'm always looking for the next epidemic. You know, it felt a lot like 2015 and the Ebola crisis. I had an incredible team at Walter Reed Army Institute of Research, and we were working on the first vaccine in humans for Ebola. It was a stressful time, but there was a general recognition that we felt like we were making a difference, and that's a lot how it felt at Pfizer, and it was a privilege to be a part of that.
I mean, looking back at that experience, I got to think, you know, when you're talking to people at a dinner party or whatever, like you're one of the heroes in this thing. I mean, I know there's a lot of them, but I mean, you're in that picture. How does that feel?
I really don't see myself as a hero. I've just had an opportunity to do advanced training, and it's an honor to be able to use my skills for something that could potentially be high impact.
Wow, what a career-defining event, though, and it's, you know, you're still going. So with a military background, now you're in industry, especially Pfizer, a gigantic company with their own processes and you know, hierarchy and everything. What was the biggest adjustment you had to make from going to military to industry?
I think the biggest adjustment, Michael, was the change in culture. And it didn't help that I expedited that transition. I retired from the military on a Friday and started at Pfizer on the following Monday.
Oh, wow.
I should have probably taken a bit more time. But my overall observation has been that the differences in how leadership is prioritized. As a military officer, there was not only an expectation that you'd lead, but there was an emphasis on leadership training, and it was highly valued in the military. And the feeling that I had when I first left was through a number of different pharmaceutical companies, it seems that there's a higher emphasis on the technical skills as opposed to leadership in general.
Yeah, I got to tell you, that was part of the reason why I wanted to do this podcast about leadership, is because there is this gap in industry about leadership training. You take someone that has great technical skills and they're the superstar in their function. Well, let's put them as the leader, and you know, it's a whole different skill set. You know, and again, in the military, it sounds like there's a lot of leadership training, but don't you see that as a gap in industry?
It certainly seems, I mean, that's been my experience. There may be some exceptions out there, but I've been in a couple big pharma companies, and that seems to be the prevailing kind of weighting of leadership versus the technical ability.
It's a gap, and that's why I think this podcast has a special place. Now, I want to speak about hiring a little bit. Of course, as a recruiter, I'm always thinking about hiring, but you were telling me something very interesting about hiring. You were reading an article or something that was about how over half the executives hired don't even last 18 months. Tell us about that and what you think the remedy might be.
Yeah, there were a couple of articles on this topic, one by Sabina Nawaz, and it was in the Harvard Business Review, and they noted that several studies had demonstrated that about 50 to 70% of newly hired managers and executives failed at their new jobs and had to leave within 18 months. And the core issue discussed revolved around onboarding, acclimation of new hires to the culture, business norms, and team dynamics. Some of the corporate changes that they tried to institute were more one-on-one time with senior executives. They utilized coaching and an understanding that new team members means a new team. And there's a dynamic at play for both the old team members and the new team members, especially as it relates to expectation management. And overall, they had reasonable success.
Well, imagine if that happened in the military. I mean, imagine if like 50 to 70% of the people that moved into some sort of leadership rank failed. I mean, that would be a disaster. So what did you see in the military that they're doing that maybe industry's not, that they could adapt?
Really, just the recognition of how important soft skills are, leadership skills, how they impact teams, and of course, teams drive the mission overall. If you have a strong team and you have a highly functional team, it makes it really exciting, not just for the team, but I think for management, and your odds of success of accomplishing the mission that you've set out to do skyrocket.
That's good advice. When we were talking earlier, you were explaining that your leadership style is like 70% transformational, 30% servant leader. And so I looked up those qualities. It sounds like you're very dedicated to the growth of others and mentoring others. But elaborate more. How would you describe your leadership style?
I think that depicts my leadership style pretty well. Both of those styles tend to be outward focused. And for me personally, there's a lot of satisfaction derived from identifying talent within an individual, helping them develop and use that talent to bring value to their team and the corporation as a whole. And I think it's really fulfilling for them too. They know somebody cares about them. They want to understand that individual's vision for the next 2 years or 5 years, where they want to be and how they want to get there, and to be a part of that.
Yeah, that makes a lot of sense. This episode is brought to you by K. Bassman International, the leader in pharma and biotech recruiting. When pharma executives need to make critical hires, they go to the experts at K. Bassman, pharma's one-source staffing solution. Visit kbic.com. Now back to the episode. And, that goes right into your whole personality and what you've done with your whole career. It's always been outward focused. It's always been about the other person. And after doing this podcast now for however long it's been, the best leaders seem to put the other person first. But when I'm recruiting, and I'm recruiting for some people that are in a leadership, it seems to be all about them and more inwardly focused. And, I'd like to get your thoughts about, if someone is inwardly focused, can they be coached to have more of an outward focus?
Yeah, that's really the first key, I think, in terms of leadership development, is to know yourself, know your motivations. I'm happy to share some ideas on that with you. But typically what happens, people who are motivated internally can really look successful from the outside. But anytime the mission of the organization shifts in such a way that it doesn't support that individual or their desires, they tend to not be able to pivot with that. Can cause disruption in the teams and bring about a lot of chaos and slow progress down considerably.
That makes a lot of sense. A lot of our listeners are aspiring leaders. That's how they sort of identify themselves. They want to be in a managerial position. So what career advice would you give to someone that is an individual contributor now, trying to position themselves to move into leadership?
No, that's a great question. I think the first thing, and I'll just reiterate what I had said before, it's really to know yourself. What are you passionate about? What gets you charged up and ready for the day, creates meaning for you and your life, and recognizing the distinction between your passions and your desires. So we may desire a higher paying job, maybe more authority, maybe being respected, but these are usually more of an outcome of knowing and pursuing your passion. So knowing your passion, I think, is incredibly important. And I do have a couple caveats to that.
Good.
And one is to make sure that your passion is healthy for you, healthy for your family, and healthy for your colleagues. I've worked with a number of executives who have a passion, much like you had brought up, and their passion is to win. And again, they look successful on the outside, but because they're so inward focused and less adaptable, it can be very destructive, not just to the team and to the corporation, but to their own health and to their family. In addition, in the long run, it's not productive for the company. So know your passion, make sure it's healthy. One of the things that's been interesting, often knowing your core passion isn't necessarily easy to find out. It can manifest itself in many different ways, or at least that's been my experience. And one way to sort this out is to engage an executive coach, and I'll give a shout out to my executive coach, Kim, at the Haven. But whether it's a professional coach or someone who can help you drill down on those core motivations, these interactions can be extremely helpful. Secondly, I think find a mentor. So how do you get a mentor? I would recommend looking around where you work, finding someone who has a similar passion, that you admire, that you want to emulate, reach out to them, ask them specifically. You can be aggressive if they would be open to mentoring you. And I've found that good leaders are usually always on the lookout to mentor others. Be afraid to be aggressive. However, good leaders are often extremely busy. So when you approach them for mentorship, consider setting a time limit. For example, you might reach out to someone for mentorship and ask if they could meet with you for an hour a week for the next 8 weeks. That gives the scope of the commitment to the one you're asking to mentor you, but it also gives you an opportunity to see if that particular mentor is a good fit for you. Third, I would say keep educating yourself, train yourself. I'm currently taking a course at Harvard for pharmaceutical executives. That's been extremely valuable. But there are lots of less expensive options out there. I've always been a fan of Harvard Business Review. There are specific individuals like Maxwell that really put out some good literature on leadership. And so you just keep pursuing leadership, keep pursuing learning about leadership and different ways to manifest that and to make an impact where you are.
Great advice. Great advice. And I want to learn more about this Harvard leadership course that you're taking. What has been the one major learning that you can share with our audience?
I think the one thing that has surprised me early on in the course, there was a lot of discussion about some of the tactical and technical aspects of product development. The second half is all about leadership. And what has surprised me is the prevalence of EQ isn't as natural as I thought it was. I think they do a great job of defining EQ, helping individuals develop that in a much broader and intimate way so that they can exercise it in their leadership and in their teams. That's probably been the most surprising to me. I thought I knew a bit about it, but I still have a lot to learn.
That's interesting. Do you have sort of a working definition for EQ? Because I try to define it to people and it's like this jumbled, mumbled mess.
Yeah, they define it in terms of steps. The first, as we had just talked about, it's really knowing yourself. But we talked about knowing your passion. Here, they talk about identifying the emotion that you're feeling at the time, being able to control your emotions, looking at the greater good. I mean, that's kind of step one. They talk about the difference between empathy and the fact that you can help people grow, but yet at the same time hold them accountable, balancing that. Not always been a strong suit for me. So those are just a couple of I wouldn't say that those are the definitions per se, but those are a couple of the exercises that they've used to demonstrate what EQ looks like and how you exercise it.
It ties right into what you said with the military leadership. You said it was a lot of soft skills. And, if someone hasn't had exposure to the military except for via Hollywood, you see these Army generals with no soft skills. They're barking at you, yelling at you like, the general in Forrest Gump trying to put his gun together, screaming in his ear. But there's a lot of soft skill training in the military too.
I think over the past decade, they've really learned that autocratic leadership is great in specific situations, especially when you need somebody to take an order, execute a mission without question, exercise their discipline to make that happen. But autocratic leadership doesn't always work so well in terms of the team environment and building incentive and those kind of things. So what they have adopted, much like this course, is that to really the best leaders, people talk about which leadership style is the best. And what you find out is that all leadership styles are valuable depending on the context in which they're used. So individuals who are able to adapt their leadership style to the situation really tend to be the most effective leaders. Traditionally, you think of the military as an autocratic type leadership organization, and I've certainly seen that. But I think there's a lot of training on how to develop those soft skills, how to develop your subordinates so that they can accomplish the mission the way it needs to be accomplished.
Yeah, I agree with you. And I see that a lot also when someone goes from a long time as a very prominent person in a hospital setting, and then they move into clinical development or something, and now they're trying to lead a team. They're not used to, leading an industry because it's always been top down, and they have to adjust and develop those soft skills. I have another question for you. I heard you subtly say that you have problems holding people accountable at times as a leadership style. The reason it caught my ear is because that is the number one thing I have trouble with too, because I'm a people pleaser. Any advice for guys like me that are having trouble holding others accountable?
Well, yeah, I can tell you what I typically do is, and that is I try to frame each individual in such a way that they know I care about them. They know that I'm interested in their success and their progress. And when you have a relationship that's built on trust, they know that if you're holding them accountable or you're bringing a negative comment or an area where they need to improve, it's really taken much better. Individuals who know that you're trying to help them be a better person, I've seen respond incredibly to corrective criticism. We tend to want to see the best in everyone. We want to actually bring to light those things that they're doing well, maybe minimize those things that need to be worked on. But from a team perspective, you need to be able to address areas that need to be corrected in the light of here's why. Please understand that if these adjustments are made, how much more value you'll bring to the team and to the company as a whole. I have to remember that.
Yeah, that's a great reminder. And it's like I've done so many of these interviews, I know that, but it's still a challenge for me. You mentioned about continual learning, and I know you read a lot because a lot of the times when we've spoken, you're citing articles at least. But are there business books that you would recommend to people listening that are trying to grow in a leadership capacity?
Michael, you may want to, can you ask that question again?
Yeah. Are there any leadership books that you would recommend to those listening?
I think I've really enjoyed Maxwell's writings. It's very sequential. There's a series of books that kind of walks you through different leadership styles and not only coaches you, but also gives you some recommendations that you can work on. One book, and I can't remember the author, is the Wisdom of Teams. Really talks about how to integrate into a team, exploit the expertise that's in the team to add value to the company, but really to promote a lot of satisfaction within the team. To me, the most productive teams are the happiest teams. They're aware of what they're doing, and not only that, but why they're doing it and why it's important. That's a couple books. I think if you get through Maxwell's book and the book on effective teams, that's a good start. And we can talk about additional books maybe following that.
Well, I thought, with your military background that you would rep Jocko Willink. I don't know if you've read those books about extreme ownership and discipline and stuff like that, but I've had a chance to read some of those books. They're pretty intense.
Well, there's an entire library of literature that the military system wants you to go through, and case studies that I think are also pretty important. And some of those authors are in that reading list.
Well, sadly, Shon, that's all the time we have for the episode, but we covered a lot of ground. You shared so many great insights. Really interesting to get a military perspective. And I just, for all in our audience, not only do we want to thank you, but we also want to thank you for how you've used your career and your life helping other people, with the Department of Defense, within the military. And definitely, we want to follow you and ARMR Sciences and look forward to seeing that continued success.
Well, thank you for the kind words, and it was an honor to be here. So hopefully it will bear some fruit.
It certainly will. But that wraps up another episode of the Pharmaverse. We have many more incredible leaders like Shon lined up for you. So make sure you subscribe to the channel so you don't miss a single insight. But that's a wrap. See you next time on the Pharmaverse.
Thank you.
Thanks for joining us on the Pharmaverse podcast. Make sure you subscribe below so you don't miss any leadership insights. Like and comment. I would love to hear from you. We'll see you on the next episode of Pharmaverse.